Great. Hi. Yeah, thank you, Sammy. Thanks for inviting me to talk to your group today. It's funny because Sammy and I actually met last year and we reconnected this year to provide this resource to you. So thank you, Sammy. But my name is Marie Cooper. I am a senior small business and employee outreach coordinator with the Washington Health Benefit Exchange. So my role here at the Exchange is to support small businesses and understanding their health insurance options through Washington Healthplanfinder, and then also supporting small businesses that are, sorry, I'm kind of changing my view on things here the same time. And I also support employees that are separating from their employer and are losing their employer-sponsored health insurance, letting them know how they can access coverage on Washington Health Plan Finder so they could avoid having a gap in coverage or knowing of an alternative other than Cobra, because as we know, Cobra can be really expensive, letting them know that, the marketplace is another option that's available to them than typically is a more affordable option. Before I get started, really, I just want to thank you all for being here today. Health insurance is important and really should be a priority when running your business. Your health and the health of your employees matter and can impact the success of your business. So, in working with small businesses, I understand really how confusing this world of health insurance can be. There is a lot of information out there and a lot of different options to make the whole process seem overwhelming. And unfortunately, there is not one simple option for all small businesses. So there are multiple options and really a lot of different factors that a small business owner needs to consider when finding the best option for them. So today, I'm going to share on the importance of health insurance, touch on some different options that are available to you, and then really go over how you and your employees can access health and dental insurance on Washington Health Plan Finder. And I apologize, Sammy, we're good to go. You said we're going to do intros first, and we were waiting for to have more people join, but are we good to kind of move through the presentation?
Oh, you're good to go.
Okay, great. Thank you. All right, so to provide you some background information, the Washington Health Benefit Exchange operates the state's official online health insurance marketplace, Washington Health Plan Finder. So this is where one out of every four Washingtonians access high quality health and dental insurance. It is highly used by small business owners. In 2023, a recent 2023 data showed that 25% of those that are enrolled in a qualified health plan were self-employed or self-employed or small business owners. So Washington Health Plan Finder is used primarily by people who are self-employed, employees of a small business who are not offered health insurance, those that lost their employer coverage, participate in the gig economy, work seasonally, and those that do not yet qualify for Medicare. So if we really kind of take that full list of people and that audience, really we're looking at people who are not getting health insurance from their employer. This is a great place where they can get coverage for themselves, for their families. Um, and then those that are maybe not eligible for Medicare yet, you're retiring, you separated from your employer and you're thinking, I'm just going to retire early. This is a great place to look for coverage options. So, what is health insurance? So, health insurance is an agreement with a health insurance company to pay for all or some of your medical expenses in exchange for a monthly premium payment. So, what is a monthly premium payment? So, that is the amount you pay each month to the insurance company, or also known as an insurance carrier, to keep your insurance active. So, why is health insurance important? Well, health insurance is important because you can't predict when you're going to get sick or injured. Having a health plan allows you to access healthcare service when you're not well. And it also allows for you to access preventative care services such as shots, screenings, etc., that's needed to stay healthy. For small business owners, your health should be a priority. Many of you may not have someone that can fill in if you're sick or need to take time off. So, your presence in the business is really important to grow that success. In addition, health insurance protects against any high unexpected medical costs that can cause a financial burden to someone. Medical costs are the number one reason for bankruptcy in the US. So having a health plan allows to share in those costs. So this is just a example of common medical services and their costs. You can see these services are expensive. So going one step further, so why should you support your employees in finding health insurance? Now, I like to point out that I use the word support your employees in finding health insurance because that can look different for very small businesses. Not everyone is able to afford a small group plan to offer to their employees. So there are ways you can still support your employees in finding or accessing health insurance so they can stay healthy without offering a small group plan. So again, why is it important? Well, it's much like your health, and as a business owner, your employees' health should matter too. If they're not well, they won't be able to add to your business success and support you in growing that business. So, health insurance options for small businesses. So, as I mentioned, there are multiple options that are available for you to access coverage, and there isn't one right option for a small business. So, I'm going to go over some options that are available to you. Um, and I'm going to start with talking about small group plans. So, if you think about small group plans, I think this is kind of what everybody thinks of when they say, I get my health insurance from my employer. So the employer purchased the plan and they own the plan and they offer it to all of their employees. So with small group plans, there typically is a minimum participation requirement. So depending on the plan that you're choosing or you're looking at, there's a certain amount of employees that need to be enrolled into that plan. Another thing is that there is a minimum employer contribution requirement where the employer is required to pay a percentage of each employee's monthly premiums, so their monthly cost. That percentage can range, again, depending on the plan, could be 50, could be 100%. These two last kind of bullet points, the minimum employee participation and the minimum employer premium contribution, can actually be a big barrier for a lot of small businesses. They're just one, they maybe don't have the employees to fulfill the requirements for a small group plan, or they may just are starting out, or they don't have the revenue to be able to contribute to their employees' premiums. So this is where individual plans can step in and take take that role of being a way to access health insurance. So with individual plans, everybody owns their own plan. So the employers own their plan and the employees own their plan. There is no connection between employer and employee on this health insurance. So everybody's really going out and getting the plan that best fits their needs. So with that, there is no, minimum participation requirements. There's no minimum premium contribution requirements. That's not a thing that is needed to be required. Also, it allows people to be able to find the plan that best fits their healthcare needs. So because everybody's kind of going out to market to find their own plans, it allows for some employees, if they need maybe a more robust plan because they go to the doctor more or they have certain medications that they have to get, they can find a plan that can fit those needs. And then the employee who potentially just needs health insurance just in case, they rarely go to the doctor, maybe when they're sick every once in a while, they can get a plan that best fits their needs. So it really allows for that flexibility of employees to be able to find the plan that best fits their needs. Again, this is a great option for micro enterprises. Again, you don't have those minimum participation and minimum contribution requirements. So great option for those micro enterprises. Or maybe it's just you starting out right now and you'd have no employees. Great place for you to get coverage for yourself and for your family. So I'm going to step through a few other options. So these are not actual health insurance. So, but they are a way that you can support your employees and helping pay for health insurance. So health reimbursement arrangements, also known as HRAs. Two of the most popular are called ICRAs and QSARA. So, and ICRAs are individual coverage health reimbursement arrangements, and QSARAs are qualified small employer health reimbursement arrangements. So, these HRAs are a way for an employer to set the amount that they want to contribute to their employees' monthly cost of insurance. It is owned by the employer and is funded by the employer pre-tax. So you put that in, and then the employees would then purchase their own health insurance and then reimburse whatever amount that you are setting. Say it's $100 is what you want to contribute to your employees' health insurance. That $100, they would reimburse that $100 every month. Other options are health savings accounts, so HSAs. That can be contributed by employer and employee, and then a health insurance stipend. So I really want to touch on this because I get this question a lot with health insurance stipends. So what that is when an employer can increases the wages of their employees and says, go out and get health insurance with this. So, for example, saying, we don't offer health insurance, but I give you $200 every month for you to go and get health insurance. That is an option. I've heard some small businesses have done this. The only thing I caution about this is that if your goal is to make sure that they're healthy and that they have health insurance, there's no guarantee that they're going to get health insurance with that increase in wages. Also, if they are using Washington Healthplanfinder to access their coverage, increasing their wages can affect the amount of subsidies that they may be eligible for. And I'll kind of we'll get into talking about what those subsidies are, but it may cause for them to lose some savings that they may be eligible for with that increase in wages. So just some things to look out for when you're doing that health stipend. I have heard stories of small businesses tell me that they, gave a health stipend to their employees and then come to find out that they didn't have health insurance and they were stressing out because they had these medical debts. And they were like, I don't know what to do. This is what I thought they were going to go and get health insurance with this. So kind of put them in a really difficult position, but just things to be aware of. So we're going to talk about Washington Health Plan Finder and individual plans. So through Washington Health Plan Finder, this is where you can access an individual plan. So I want to be really clear that we do not offer small group plans or shop plans on Washington Health Plan Finder. Small business owners can access quality individual health and dental plans on Washington Health Plan Finder and support their employees in finding quality coverage by referring them to Washington Health Plan Finder. So that's how a small business owner can utilize this platform. So even if an employer is not able to offer a group plan, they can still invest in their employees' health by directing them on where to go. So as I mentioned, Washington Health Plan Finder is Washington State's health insurance marketplace. So what does that mean? So really that means there are multiple plans and multiple carriers all in one place to really allow for individuals to find the health plan that best fits their needs and also their budget. It is the only place where you can access federal and state subsidies, our federal subsidies, Cascade Care Savings, to help lower your monthly cost of insurance. And this is also where Washingtonians can determine eligibility and enroll into Washington Apple Health, which is Medicaid in our state. So these last two bullet points, these savings that I'm talking about, these can really help a small business owner and employees be able to afford health insurance. So, and these again are only available through Washington Health Plan Finder. Now, I've been saying quality plans, you can access quality plans. What I mean by that is that all of the plans on Washington Health Plan Finder are regulated plans. That means they all need to offer these health benefits to even be offered on our website. So you can see there's behavioral health, services, preventative care services, trips to the ER. These things all are offered with all of the plans on Washington Health Plan Finder. Also, nobody is denied coverage or rated higher for a pre-existing condition. So how much does coverage cost? So when you fill out your application on Washington Health Plan Finder, you will get an immediate eligibility result, and it will tell you if you're eligible for either Washington Apple Health, Medicaid, or a qualified health, qualified dental plan. And that's going to be based off of your household income and your household size. So if you're eligible for Apple Health, Medicaid, it is free or low cost. If you're eligible for a qualified health, qualified dental plan, those prices are going to vary and it's going to be based on your age, your household income, household size, and then also the county that you live in. That's because that is the main factor. Those are the main factors that determine the amount of savings you may be eligible for. So again, those savings are going to come in the form of federal tax credits and or Cascade Care savings, our state subsidy. And I'm sorry, one second. I think I have to sneeze. Okay, I'm sorry. It went away. Okay. Um, so those savings are again exclusively only available through Washington Health Plan Finder. I did want to share the statistics. So 68% of self-employed and business owners are benefiting from federal tax credits. So you can see over half of the small businesses, owners, and self-employed that are in a qualified health, qualified dental plan, accessing coverage through Washington Health Plan Finder are benefiting from those federal tax credits. So it can really help in making coverage affordable. All right. So I mentioned Cascade Care Savings. I'm just going to touch on our Cascade Care program. That's because Cascade Care is the exchange's primary affordability initiative. It's made up of Cascade Care plans and then also Cascade Care Savings. So Cascade Care plans. So these are our high value plans. They offer more services before deductibles. They typically have lower monthly premiums. They are available in all counties and are offered by all of our insurers. So these are our most popular plans. And the other part of that is Cascade Care Savings. So this is our state funded subsidy that lowers monthly costs. This can be combined with federal premium tax credits, so it can stack on top of those tax credits. For the max amount somebody can earn for 2026, for the 2026 plan year is $55 per month per member. And then for those that are not eligible for federal subsidies, the max amount they can earn is $250 per month per member. So these savings again are only available through Washington Health Plan Finder. So who's eligible for Cascade Care savings? So to be eligible for Cascade Care savings, you need to be eligible for a qualified health, qualified dental plan. So people who are not eligible for Apple Health. You have to have a household income at or below 250% of the federal poverty level, and you need to enroll in the Cascade Care Silver or Gold plan, and then accept all available federal premium tax credits that's being offered. So this is really important. This 250% of the federal poverty level, that's because it has been identified that this population who's not eligible for Apple Health could still benefit from additional savings with the state subsidy. And that's why it's set at that 250% of the federal poverty level. So nobody knows what that means. I couldn't tell you off the top of my head what 250% of the federal poverty level is, and it changes every year. So this chart shows you what that looks like. So for a household of one, the max income they can earn per year is $39,125 to be able to qualify for Cascade Care savings and for the state subsidy. The other thing that is not listed here that I want to bring up is that if you are eligible for Cascade Care savings, You are also eligible for a qualifying life event to enroll outside of open enrollment. Now, we're going to talk about enrollment times coming up next, but just wanting to tie all of this in for you because I'll refer back to Cascade Care Savings as a qualifying life event. But we can see from this chart, a household of two, max income is 52,875 per year. So that's how that works. So this is just an illustration of somebody who, is enrolling into coverage. They're enrolling into a Cascade Care Silver plan. Their cost is $525. They're getting $425 in federal premium tax credits. That would bring down their monthly cost to $100. That's before Cascade Care Savings. Cascade Care Savings then comes in because they're eligible for the max amount. So that $55 is applied, and then their monthly cost is $45 per month. Oh, and I should probably just say, so that was just a really good example of how it can stack on top of those federal tax credits, and both somebody can receive both of those. So when can you sign up? So those that are eligible for Apple Health, you can enroll any time of year. For qualified health, qualified dental plans, you typically have to enroll during our fall open enrollment. So that starts November 1st and goes until January 15th. So that is part of the reason why we're giving this information now, is that we are quickly approaching open enrollment. So again, it starts November 1st to January 15th. However, if you are looking to get a January 1st start date, you do need to enroll by December 15th. So any enrollments after December 15th, so December 16th to January 15th, would then receive a February 1st start date. So there are ways you can enroll outside of open enrollment, but you do need to experience a qualifying life event. There is a full list of qualifying life events on our website, but some examples of that would be loss of employer coverage, a move to Washington State, and then here we go, an eligibility for Cascade Care Savings. So if you're under 250 of the federal poverty level, you're eligible for Cascade. You're eligible for open enrollment. Or sorry, a qualifying life event to enroll. You typically have 60 days before or after that qualifying life event to enroll into coverage. And that's really important to note too, because if you miss that 60-day window, you may have to wait until open enrollment to apply to coverage. So these are our carriers for the 2026 plan year. This is, for the most part, the same as last year. The only thing is that we added one carrier, which is WellPoint for 2026. So when you're ready to enroll, this is the information that you need. Again, this is on our website. So don't feel like you need to write this down, but this is on our website. One thing that I will point out though is if you are going to fill out the application on your own, we do try to make it that it is self-serve, that you're able to do that. One thing that you want to make sure you do is make sure to list all members of your household, even if they're not applying for coverage. This is because it'll allow for you to get the serve to you the best health plans and savings for your situation. Because remember that your household size does matter. So if you have a household of five and you're making this income, and then you're only a household of two and you're making this income, it can change the amount of savings you may be eligible for. So this is our official website. It's www.wahealthplanfinder.org. This is what our homepage looks like. We recently had an update to our homepage. So if it looks a little different than you're remembering. I think it happened a couple of days ago. So this is what it looks like. There are some lookalike sites out there, so I always like to point out what it looks like so you're making sure you're looking at your options in the correct spot. However, I was surprised by the update, so I do want to just point out the best way really to access our website is just to type into your web browser our website, which is again www.wahealthplanfinder.org. So on our homepage, We have a tool that allows for you to get an estimate of the savings that you may be eligible for and review the plans that are available in your county. So on that homepage, just look for this, what we're seeing in this red circle here, estimate your costs, click on that, and then it'll ask you some basic information about your household. And then from there, it will give you that information that you're looking for. So an estimate, and then you can review all the different plans. And then our Cascade Care logo is here on the side. Just remember when you're looking at the different plan options, be on the lookout for these Cascade Care plans just because they are our high value plans and they offer more services before deductibles, typically have lower premiums, and are our most popular plans. So we do offer another tool called Smart Plan Finder, and this is our online decision support tool. So we have a lot of plans on our platform. It's great because you have a huge selection to choose from and find the one that best fits your needs, but can be overwhelming. So when you are shopping for plans, this pop-up that says, "Do you need help shopping for a plan?" is gonna come in front of your screen. And I mean, you can skip through it if you want to, but if there is something you need from your health plan and you would like help sifting through all the plans, this could be a helpful tool. So you can put in any providers, any prescriptions, the amount of times you go to the doctor, and it will take all that information and filter through all the plans that we have and provide you the ones that best fit your needs. All right. Another thing just to bring up for this year is that if you have a health savings account, an HSA, uh, for 2026, all bronze plans and catastrophic plans on Washington Healthplanfinder are eligible for an HSA. So they're compatible with HSAs. So before you would have to find a bronze plan that said HSA next to it. Doesn't matter. You don't have to see that tag on the plan anymore. If it's a bronze or a catastrophic plan, those are compatible with HSAs. So again, we try to make the application self-serve so you can fill it out yourself, but don't feel like you need to. We offer free enrollment assistance. We have navigators, we have tribal assisters, we have producers, also known as brokers, and we have enrollment centers. And we also have our customer support center. So they are all available to help you enroll and fill out that application from beginning to end, talk about your plan options, go over the financial portion of it. As a small business owner, I do want to bring up that financial portion of the application and reporting your income can be tricky because I know that sometimes your income is fluctuating or you have a seasonal business. You I encourage you to work with an assister, so a navigator or a broker with that part of the application, especially if it's your first time, and just learning how to report that so you can be as accurate as possible. The biggest thing is making sure that you don't accidentally underreport your income and then receive too much tax credits. If that is to happen, you may have to pay back those tax credits at the end of the year when you reconcile your taxes. So it is an important part of the application and trying to be as accurate as possible. So again, I encourage you to work with an assister, at least for the beginning part of filling this out, to really understand when you should be updating, how you should be reporting, so you can be as accurate as possible. Our customer support center, that number is there on the screen. They're also available to help, and they offer language assistance in over 200 different languages. So if you or your employees are needing assistance in a preferred language, feel free to refer them there. Right. And so this is the way that I support small businesses. So again, my role is really to help small businesses get the coverage that best fits their needs. It really isn't to say, hey, you should be in this plan, or you should be doing an individual plan, or you should be doing a small group plan. It really is to just be a resource and provide them the options, so they can get the plan that best fits their needs. So I'm available to, explain the options to them, to provide informational handouts for you or for your employees, and then also be a connector to brokers. So I work with a lot of small businesses where they're just starting their journey of understanding what health insurance options are out there and which is best for them. And so if a small business owner is looking to, explore small group plans and compare small group plans to individual plans or look at HRAs and HSAs, and if that would be something that would work for them, I'm happy to connect them to a broker in our enrollment center to help them explore those options. So again, we don't offer small group plans, HRAs, or HSAs on Washington Healthplanfinder. We really just do individual plans, but I'm happy to be that connector so you can get the coverage that best fits your needs. So to get access to these resources, you can email me at smallbusiness@wabiexchange.org. And then I am just going to give a few updates and updates of kind of what's going on with how we're. I'm sorry, a few updates on how of federal changes that are happening and how we're kind of responding to them, just so you're aware. So again, a lot of federal changes are coming down the pipeline. We do have, our marketplace rule that finalized. We had the HR1, and there are some factors that are affecting accessing coverage on Washington Healthplanfinder. So one of the biggest things that we're watching is the expiration of the enhanced premium tax credits that is supposed to expire at the end of this year, so December 2025. So with that expiration of those enhanced tax credits, we are looking to see that people's health insurance costs are going to increase. And so, what these enhanced premium tax credits are basically with the American Rescue Plan Act of 2021 and the Inflation Reduction Act of 2022, there had been a temporary enhancement of the federal premium tax credits that people were receiving who were accessing coverage on the marketplace. It made it available for people who are over 400% of the federal poverty level to be able to access federal tax credits, and then also reduced the net premiums to zero for many, but not all people whose federal poverty level were between 100 to 150%. So if, again, these enhancements are not extended, they're looking to expire, then we're going to see an increase an increase in the cost of coverage just because there will be less federal tax credits being provided. So with that, though, there are some things that we're doing, and I should go back one slide, but there are some things that we're doing to kind of help to mitigate this. So one of the things is that we are implementing something called premium alignment. So what that is basically we are increasing the cost of the silver plans, and that in turn is causing for more federal tax credits to be available to help drive down the costs. So if you have used Washington Healthplanfinder before, you may see a difference in what plans are being offered to you or served to you if you're over 200% of the federal poverty level. Typically, our silver plans are the best option. They're usually the more affordable. But for some, because of the silver, the increasing the price of the silver plans and more of those tax credits being available, gold plans may actually be more affordable for some people. So those plans are going to be shown first when you get the plan options. So just a heads up for that. Not a bad thing. It's actually a good thing because if you're getting gold plan, typically it's a more robust plan, and you'll be seeing them at a lower cost than the silver plans. All right, some other tax credit changes for 2026. One is last year in November, DACA recipients were eligible for federal tax credits starting October 1st of this year. That has been removed, so they are no longer eligible for federal tax credits. And then also starting in 2026, January 2026, enrollees under 100% of the federal poverty level that are not eligible for Apple Health because they just haven't met the 5-year bar. So they're here lawfully, but have not met the 5-year bar, will not be eligible for federal tax credits as well. These two populations, though, are eligible for the max amount of Cascade Care savings of the 250. So when I was kind of giving the difference of the 55 for people who are eligible for federal tax credits and the 250 that are not eligible for tax credits, that's this group that they'd be eligible for the 250 because they're not eligible for federal tax credits. Also, another thing that has changed and is something that you want to really be aware of is the tax credit repayment caps. Those are going to be removed for 2026. So what that means is reporting your income is going to be really important moving forward because in the past there was a cap of the amount of repayment that you had. I think it followed your federal your FPL, your federal poverty level. It was a percentage, and so moving forward in 2026, that cap is being removed. So if whatever your additional payments that you received, your overpayments that you received, you will have to pay all of that overpayment back. So there's no cap on that anymore. So, but again, there's a lot of things that are coming down the pipeline. And we are really doing our best to make sure that we're staying on top of understanding all of them and responding quickly to these changes that are happening. I can say that we are committed to supporting Washingtonians and accessing health insurance. So we are looking at, being creative, looking at ways to make sure that we can support Washingtonians and making sure they're getting the coverage they need, that it's affordable and making sure we're supporting everyone. So that is my presentation. So I'm happy to answer any questions that anybody has.
Great, thank you, Marie. Again, feel free to either unmute yourself to ask a question or put it in chat. I just wanted to highlight while they're waiting to see if anyone chimes in with, at the beginning you had said, if you give your employees the pay increase to cover health insurance, that can have them out of tax credits and affect their taxes. So if they wanted to explore those other options like the health savings account or the other one, and they can contact you for help on who to talk to about those options.
Yeah, I'm happy to connect them to one of our brokers in our enrollment centers.
Wonderful. Lisa?
So I enrolled with a health plan that got me access to the medical services that I wanted to have. And then about 3 months in, that medical group dropped the insurance plan that I had enrolled in. And so I had to completely find new providers. And since the plans ask us to commit a year at a time, I was a little surprised that the insurance companies didn't have to also commit.
Yeah, I'm not quite sure on that situation, Lizelle. Was it that and I'm just a follow-up question. Is it that the provider that you're using no longer accepted that insurance, or was it that insurance carrier
It was the
no
it was
longer offered that plan?
it was the former.
Okay. Yeah, I'm not quite sure how that all worked and that portion of it. So I'm sorry. Unfortunately, I don't really have answers on like how the carriers what plan offerings they offer.
And is there any way to find out the, how do I say, user approval of various insurance companies? Because I went with one that looked really good and it turns out nobody locally would take them. which was okay.
Yeah, that's a good question. And I probably should also say that, I mean, that situation, it doesn't sound common. I mean, I feel like if that was a common thing, I would have heard about, insurance carriers just like all of a sudden not offering a plan. It does sound a little interesting. I'm gonna actually follow up and ask about that after this, if that's something that happens or if it's anomaly or whatever. But the one thing that you can use is the Smart Plan Finder tool, where you can put in providers and then see if it's offered on, or you put in the providers and see if they accept that health insurance. So you can use that. I do still have to say that the best way though, to confirm if a provider does take an insurance carrier is to actually give them a call and ask. I know it's a little bit of a pain, but it is the best way just to really make sure that they're accepting it.
I would back that up as well. I talked to more than one person who said like, oh, the website said they accepted it. And then I went into the office and they're like, we don't accept that. And the office staff, if they're planning to not accept it at some point, they might be able to give you a heads up of like, hey, we won't be accepting that in 3 months or whatever.
Yeah, because sometimes like one, we have to update it, so they have to let us know, that they're no longer accepting it or what they're accepting. So it's kind of, there can be some things with that, some misses with that. Also, I think when they put it in the information in the system, it has to be keyed exactly how they're offering it, and so sometimes it can be um, not exactly 100%. So that's why I think on that slide it had a disclaimer that said you should still call the provider just to double check them, make sure it's accepted.
Yeah, Brett, go ahead. Nope, you're muted. If you're talking, we can't hear you.
Yeah, no, I wasn't talking, just trying to find the mute button. So I'm just looking at the search engine on the Washington Healthplanfinder, just looking at, preemptively putting in our information for next year just to see what we'd qualify for.
Mhm.
And I know because talks have stalled, at the federal level, we don't yet know how many federal subsidies are going to be available per plan. So what we're looking at now, I mean, it's kind of a moot point because we can see kind of the breakdown in the savings details of how much the federal government would cover versus how much the Cascade Care would cover if you qualify for that. So so we go online November 1st to find a new plan for next year. What do we expect to find there as far as savings?
Yeah, that's a great question. Thanks for bringing that up. So if you're using the estimator tool, one, you're going to want to make sure you're using the 2026 tab. So you can see at the top that it'll say 2026. We are preparing that they're not going to be extended. So that's what you're going to see. So you're going to see if nothing is extended, these are the tax credits you're going to receive. This is the Cascade Care savings you should receive. So really, honestly, the Cascade Care savings really shouldn't change, just because it's based off of your federal poverty level. Like if you're under 250% of the federal poverty level, like that, it's going to give you that amount. So that's the state subsidy isn't affected by the federal government of how much tax credits you're going to be eligible for. So that should be okay. It's these federal tax credits. So again, we're now preparing that they're not going to be extended because we don't know and we can't guarantee it. And we don't want people to sign up for coverage and then all of a sudden see like, oh gosh, it wasn't extended and their premiums increase. So if they are to be extended, if they end up doing that, so we will respond and we will update the site and make sure that people are getting the tax credits that they deserve. But as of right now, what you're seeing, I mean, that is an estimate. So I always like to point that out too. So that is an estimate. To get the most accurate amount of savings you'll have, you'll want to fill out the application, but it'll be pretty close to what maybe you're eligible for 2026 without the extra enhanced subsidies.
Okay, so we're looking at like a zero. So like I'm just looking at a particular plan and there's like $1,000 in tax credits. So those are completely going away per month. So someone like, in my family situation, we would have to pay that, the full cost of that insurance minus whatever we get for the Cascade Care. So it's still going to be like $900 to $1,000 per month.
So there will still be tax credits. It's just not going to be enhanced. So it's not going to be more tax. So people are receiving more tax credits than they ever had before
Got
with
it.
the
Okay.
during the pandemic. And so there's still tax credits. It's just going to be less tax credits available. So everybody will see kind of an increase in their their cost of coverage for the
Thank
most
you
part.
for clarifying that. Yeah. And the last question I have is I didn't even find out about Cascade Care savings until it was like December 10th or something, and they were already fully committed. And so do you have an estimate? Like when do those run out? I mean, do you have to get online like November 1st to even get those?
Yeah, that's a great question too. So, Cascade Care Savings for 2025 plan year, they were exhausted because they were funded for, oh my gosh, I want to say like 2 or 3 years. And it outperformed what we had expected. And so this last year in 2025, we kind of were like, oh, we only have this many Cascade Care Savings available. So people who enrolled by a certain time during open enrollment, those people were able to get them. But that's not really typically how it goes. And so even new enrollments during 2025 plan year, so if somebody lost their job and they lost their job and they're applying to coverage in April and they were eligible for Cascade Care Savings. It really was designed that they would get Cascade Care Savings. But because we were running out of funds because of how it performed, for 2025 plan year, it was only people who enrolled during open enrollment and it wasn't available for new enrollees in 2025. We got funding for the 2026 year for Cascade Care Savings. So that was one big thing, knowing that, these changes were going to happen on the federal level that we really pushed for to get funding for Cascade Care Savings again. And so that's where this is available again. And it should be available for new enrollees again in 2026, like if it's not during open enrollment timeframe. So it's available. So typically, last year was kind of a different thing, a different situation because of the funds exhausting. It was our first time having the state subsidy. So moving forward for 2026, it should be available really all year round for any enrollees.
Awesome. Thanks so
Yeah.
much.
I had a quick question. If you unintentionally underreport your income, is there an additional penalty over above paying back the funds you should have, the credits that you took?
Yeah. No, there isn't. You would just have to pay it back.
Thank you.
Yeah.
And I'll just ask another quick one since it's quiet. If What's the best resource for us to find somebody to talk to in terms of estimating, like people such as myself and many others I know who have extremely variable income, and it's really hard to predict. I mean, I can't even predict. So, what resource would you refer us to, or if you have yourself have a suggestion?
Yeah. So I would probably say working with one of our assisters. So connect with a broker or connect with a navigator on that part of the application just to double check and make sure that you're reporting that right. Or, I mean, really, you can have them fill that part of that application with you, fill that part out with you. Um, it is good to know. They're really knowledgeable. So they should tell you when you should go back to update your income. So it's $150. If you have a difference of $150, you should update your application to reflect that. But there are different ways that you can report your income. You could do, a point in time of what your income is and then adjust it throughout the year. Or you can just kind of do an average of what your income is going to be. So it kind of just depends, but you just want to be a little bit conservative on that, on reporting that income part, so you're not under-reporting. But I would highly recommend working with one of our assisters to do that portion of it.
And I put the search for the navigator in chat.
Oh, perfect. Thank you.
All right. Any more questions?
I guess I'll ask one more while we have you. Can you reiterate or state again, if you've already said it, what the percentage of the enhancement was over the tax credits that we're going to be expecting to still have next year?
I didn't. I don't, and I don't have that
You don't know.
information.
Okay.
Yeah. Yeah.
So what we see right now, if we go onto the Health Plan Finder and just search for plans, that isn't accurate, right? That's based on this year's enhanced benefits.
So if you're under the 2026 tab,
Yeah.
that should be without the enhancements.
Oh, okay.
That should be for the 2026 plan year. That's what you're looking at.
Yeah.
Again, it is an estimate. It's an estimating tool, so it's not 100% accurate. To actually get the most accurate amount, you will want to fill out the application, but it'll give you a good idea.
Okay. Thank you.
Mhm.
Okay, I'm going to follow up really quickly. So if I go to the Navigator search, it's asking me to pick an insurance company. But what if I don't know which insurance I'm going with and I need to get a question answered?
Um, if you go to the navigator search, the organization name, is that the part you're talking about?
Yes.
Oh, okay, yeah. So that's not actually an insurance company. So that is, we have different organizations that are navigators. They aren't, this isn't an insurance company. So our navigators can be in kind of various different places. Like they could be like community-based organizations. They can be, so it's not, we're not looking at an insurance carrier. It's really just where they're associated with. But you don't have to fill that part out. Really, all you have to do is if you want somebody local in your area, just fill out the zip code, and then it should provide you a list of the navigators in your area. If you did need help in a specific language, there's also a language service drop down too that people could utilize.
Unfortunately, me poking around, it doesn't look like there's any in Island County. So you might need to go a little farther afield, but just looking down the list, Linwood was on there. So looks like there's some just off Island. And I know there's one in Port Townsend.
And if somebody would, I mean, really, it doesn't have to be somebody in your community. Sometimes people feel like they want to have somebody in their community. It doesn't have to be that way. The other thing is if you want to talk to a broker, because maybe it doesn't hurt to work with a broker or connect with them. Their services are free. And, you know, if you're in the beginning part of your business and you eventually see yourself of potentially having more employees and you know, offering a small group plan in the future, it may, I mean, you may want to just connect with the broker now and build that rapport. And then once your business grows, you know, you already have a contact and you can say, hey, I'm ready to start looking at small group plan options, and you already have that. So if you want to connect with the broker, you can email me and I'll send that out to you, a list of brokers. And if you're going to, if you look for brokers on your own, and the reason why I do this is that I have heard that it is hard to find a broker that works with small businesses. So it may help.
Well, wonderful. If there are no more further questions, I just want to thank Marie again so much for all of this incredible information. Thank you all for joining us. I put it in chat, but you can check out this and other workshops on our YouTube channel. And we have some workshops coming up for working artists and for food producers. So go ahead and check those out. So again, thank you so much, Marie, for joining us.
Thank
Thank you,
you. Thank you,
everybody.
everyone. Have a good day.